Hi, everyone. So here we are again, and we're here with Dr. James Schaller. We're very happy to have him as such a wonderful expert on Lyme disease and co-infections. He's been treating Lyme disease and co-infections for just years and years and years, and you will find his link and information on the Band-Aid Lyme website. So our next topic of discussion that we'd like to talk to him about and ask him questions and pick his mind is, Dr. Schaller, how prevalent is Lyme disease and co-infection in the United States? And do you actually consider this an epidemic?
My feeling is it's absolutely an epidemic. Lyme has been around and noted in Europe for well over 100 years. It's been noted in America for many years before it was popularized in New England. And we know that insurance claims are approximately 500,000 a year, but that's not really aggressive testing. And what we know by the standard testing, like ELISA and Western blot, that most people would get from their doctor, that they miss so many. They don't test for all the strains. They don't test for all the species. So unfortunately, right now, there's not a test that you can ask your doctor to pay for to diagnose you. And the same is true with Babesia, which is no joke. It's a single-celled parasite. And then Bartonella, the same thing. So unfortunately, to really be tested well so that we really do know the numbers of these infections, you need to use labs that have invested millions in doing a good job. Many of the big labs do not care about doing a good job. I would say millions for all three.
I would have to agree with you. So the CDC currently reports roughly 300,000 to 400,000 cases a year, but from my own research, given my own experience and talking to my hundreds and thousands of connections now on Facebook and just my friend circle in Greater Boston, none of them have been reported. I went to the top hospitals right here in Boston. I will not name doctors, but I went to the tops, chiefs of infectious diseases, the infectious diseases doctors that have been in these departments for years and years and years. When I mentioned anything about ILADS, which is the International Lyme and Associated Diseases Society, they would say, oh, that's fake science or something, or that's not, they're just completely dismissive of anything that's outside of the quote unquote CDC box. They want to adhere to the testing methods that were taught to them in medical school, namely the Western blot test, or these other tests that aren't really as accurate as you've noted. And when I was at my sickest point, almost, I could barely crawl into these offices. I mean, literally, I could barely crawl. And they ran these so-called Western blot tests. They never gave me a copy, but what they did do is gave me a phone call quickly saying, you're negative, goodbye.
Right.
Sorry, you're negative, goodbye. It must be something else. And I thought to myself, and this is before I really understood anything about Lyme. I didn't really know what questions to ask. And I think I was a perfect representative of millions of other people. They just trust what their doctors are saying. They trust, wow, I'm going to a big hospital here. They must know what they're doing. This is infectious diseases, for goodness sake. Here I am in Boston. I'm in the medical capital of the world, where all the teaching hospitals are. Harvard, all BU, all the teaching hospitals, Tufts, Northeastern, here we are. And you're trusting these professionals. You're putting your complete faith and trust in these professionals who are actually, unfortunately, not Lyme literate. Now, maybe as just a side note, can you mention or explain to the audience, what is the difference between this traditional medical route that follows the CDC guidelines as opposed to being a Lyme literate physician? What is the difference?
I think the practical difference is infectious disease doctors who do some very good work are really experts at AIDS and tuberculosis and other kinds of resistant infections that aren't responding to antibiotics, and many others, and they do a good job. The problem is when it comes to emerging infections that are tick or flea or lice or whatever carried, they're really weak on these areas of emerging infection. And clinicians like me, 29 years ago, when my kids were crashed and my wife was told she had cancer, which ended up being babesia, I didn't have the option of going to Tufts or Harvard or whatever, because I already knew what they were going to say, because it doesn't take long to find out what they're going to say. So I had to run down people that were on the front lines, and it was a very short list, believe me.
I know, I'm sure it was.
Oh, it was so short. It was unbelievable. And then I realized, holy cow, I got to figure out how the heck to treat this stuff. There's no books on it. I got to start trying to write stuff. And people were very helpful. So I think the biggest difference is a Lyme literate doctor is going to say, I am going to take you seriously. I'm not going to mock you. I'm not going to insult you. I'm not going to tell you you're crazy. I'm not going to tell you you're old. I'm actually going to listen, take the wax out of my ears. And the other thing is, I'm going to use labs that have spent the money making sensitive tests. And that really makes all the difference in the world. Whereas a regular infection doctor, and if I had AIDS or TB, I'd be seeing them. That'd be fine. I appreciate them. But they are just so weak in this area. And I just don't think it's going to break through for any time soon. What'll happen, I believe, is what's happening. More and more Lyme literate doctors are emerging. Used to be one in my state or two, and now there's like 70. So
That's good.
You're going to have a flood of people saying, I am not going to sit back and watch these people suffer. Something is wrong. I trust what she's saying. I trust what he's saying. I'm going to figure it out.
So how can now, okay, so for the audience, whether you're a patient or a medical professional watching, there are some institutions now like ILADS that have offshoots called, for example, ILADEF, International Lyme and Associated Diseases Educational Foundation. Right. They offer courses that I believe offer CME credits, I think, maybe not, but they do these Lyme literate educational series on various topics that help a physician, maybe a young upcoming physician or even an older physician, understand the dynamics of Lyme disease and perhaps how to approach these different symptoms and treatments and what to do. And then there's another organization by Nev Zubacek, and she's out of Harvard, and Chris Newby, who wrote the book Bitten. And there's one other woman, and I cannot recall her name. Forgive me for not recalling your name, but I know you're on the board there for the development of this organization. They're called Invisible International. Now, they are also offering educational courses, I believe also for CME credits. Mm-hmm. So they are another option. And then I think there's these other intern type of programs for people. I think Dr. Horowitz has something, and I'm sure through Dr. Schaller, you could contact Dr. Schaller and he could give you some pointers. He served as a consultant to many other physicians and researchers over the years. So there are these options for people who, physicians and practitioners all over the country and the world, who want to learn more and know how to better treat and approach these very strange infections that other doctors, mainstream doctors, find it very difficult to diagnose and treat.
There are very few things that are as exciting as taking somebody that's totally hopeless and demoralized and seeing an absolute revolution in their life. seeing them revived and they have their life back and they actually are laughing. I don't mean softly laughing, they are really laughing. That is so fulfilling. So what I would just say as an appeal to the audience, doctors or non-doctors, you will be rewarded for spending time with this. It's not infinite. It will take more than 10 hours. But for example, the very helpful iLads courses are very good and very helpful. And many of them have CMEs. And you'll find it very fascinating. And why not be part of the future? That's the invitation. Be part of the future or be left in the dirt.
Right. Dr. Schaller, one thing that I've noted, I've been calling Lyme disease the new AIDS. But even worse, AIDS now has a pill you can take once a day. Lyme patients, as we know, that's not the case. What do you think of that comment that Lyme is the new AIDS?
I think that's brilliant. And I think that's very fair. And, you know, at the beginning of AIDS, they didn't know what was going on. And with Lyme and other tick-borne infections, they really don't know what's going on. And they do silly tests that are incredibly weak and miss so many people. And the treatment really requires a good deal of, you know, some learning, much like AIDS did in the beginning, where you had to learn about different treatments. So I think you're dead on.
That's been my feeling on the matter. Okay, so for the rest of this discussion, let's just chat about how does Lyme disease and the co-infections manifest in one. I mean, from some doctors and researchers we've heard, like from Dr. Klinghardt said, I think in one of his comments that's become a meme now on different Facebook things, that he said, I've not seen a patient in 5 years or something that wasn't originally diagnosed with, like, let's say dementia, Alzheimer's, ALS, MS, but actually it turned out to be, guess what? Lyme and co-infections, probably Lyme and Bartonella in the brain. So when we think about dementia, Alzheimer's, ALS, MS, degenerative disc disease in the back, mental health problems, bipolar tendencies, depression, paranoia, schizophrenia, hallucinations, insomnia, autism in children, that was proposed in a recent documentary film that just came out called The Monster Inside Me. There was a physician who mentioned that, goodness, he's had a lot of autistic children come in and he's treated them, and well, their symptoms resolved and they became normal children. So what do you think about all of these types of things and how they actually relate to Lyme? And is there credence in that these other labels of or diagnoses of these health conditions are actually likely, could very well boil back to some type of tick-borne disease?
Well, let me start with the last part first. There is no question in my mind that Lyme, which drills into the brain, it's there in 2 weeks in everybody, and it loves the brain fat. Babesia, which is in the blood, and Bartonella, which is also in the blood, that all of them can have the potential to cause all psychiatric neurological disease. I think the question I would reverse is, what doesn't it cause? My feeling is you check because it could possibly be a cause. And then I think you really do want to address the clock. You really want to move fast. You don't want to sit around for a year. Well, maybe, I'm not sure. You know, it's a 2-hour drive to see that doctor that knows what they're doing. No, I would go do the testing, because if you catch it at that point, you may be able to reverse will partially reverse, but certainly prevent further damage. And I have cases like that where there is the beginning of damage and they just came to me and we're definitely stopping the damage. That's it. We're done with it. Now, in terms of ALS and MS, MS in the 50s, I believe it was Gardner, wrote approximately 7 papers showing that there was a spirochete, which is the shape of Lyme, that was involved in MS. She wasn't, I think it was a he, I forget, was not listened to, and that's certainly not something that's popular with neurologists now. I do have patients in my practice diagnosed with MS, and they do have things like Lyme and tick-borne relapsing fever, which is similar to Lyme, and other things, and we're treating it. If they have bad symptoms of ALS or MS or dementia or anything, I'm kind of letting them get the treatment as I'm fixing the other stuff. And not all the treatments turn off the immune system. So there's newer treatments that don't cause that problem. And so that would be maybe an overview. The thing about me, I'm in Florida, and if you say something without lab proof, they'll take your license away forever. So I gotta be a little bit careful and not say anything beyond kind of the facts that I have.
Right. Okay. So I think that this discussion for this point, I think we've made the adequate points that we wanted to make for this particular chat that we've had. And I think we'll wrap up here, and we're going to move on to another topic just shortly. But Dr. Schaller, I just want to thank you so much for this, for your informative information that you've presented on this material. And audience, please stay tuned, because we're going to shift over to yet another discussion. And so we thank you, and we wrap from here. Thank you, Dr. Schaller.